for their families plan now benefit from unprecedented transparency. And I want to congratulate Senator Rockefeller in the Senate for introducing that legislation, had the opportunity to work with him. Doctors, nurses, healthcare professionals able to receive grants and loan forgiveness. Healthcare centers, community healthcare centers, 23 million people get their coverage through community health centers. That's where they get their care. And now we are doing something about making sure that they have the resources that they need to address people's needs. The exchanges is going to open, as the senator pointed out. Families will have more choices, more access to quality insurance plans in the future. There is so much good in this law that we are seeing it happen. You know, for the naysayers, premiums are coming in well below what people said that they were going to be. Medical loss ratio, where now you have to spend 80% of that premium on a person's health care. People are seeing rebates come back to them when that hasn't been the case. The Kaiser Family Foundation study found just last week that once the exchange operate, insurance premiums under the Affordable Care Act will likely be even lower on average than what the CBO predicted. Let me get to a final point. It is a little bit like, and I know my colleagues, Congressman Van Hollen and Congresswoman Schakowsky, would, in the House of Representatives, Senator, it's like Groundhog Day. It is Groundhog Day. We have now voted 40 times for this. What they want to do is to repeal. Get over it. The House passed it. The Senate passed it. The President signed the law. The Supreme Court upheld this effort. And boy, were they upset when that happened. Were they upset when that happened? And now they view that their only role is to defund it. It's not going to happen. The American people don't want to see it happen. They want to see this law implemented. They want to make sure that the changes are there to make sure that it works. That's our job. That's what we're going to continue to do. And they can go on as many times as they like, but they're going to be turned back. This law, it is the law of the land. It will be implemented, and it will make an unbelievable difference to American families in their ability to afford health care insurance for themselves and for their families. It is going to be, ultimately, this is about saving lives. And it's not about politics. It's not about a political ideology. Thanks for allowing me to be with you today. And let me pass off to someone who has spent a lot of time working through this issue, and that's my colleague from Maryland, Chris Van Hollen.
Thank you, Rosa. Thank you, Rosa. And it's great to be here with Americans United for Change to celebrate the huge benefits of the Affordable Care Act. And Senator Whitehouse and Rosa DeLauro have described those benefits well. Great to be here with Jan Schakowsky, who's been one of the great leaders in that effort. It will provide more affordable health care coverage to millions and millions more Americans. And my colleagues have gone into detail on the benefits. What I want to talk about is what the alternative is, because our Republican colleagues for years now have said they want to repeal and replace the Affordable Care Act. Not just repeal, but replace it. We've never seen the replacement. They've never brought a bill to the floor to replace it. And you know what their replacement is? It's back to putting the insurance companies in charge of health care, back to allowing insurance companies to discriminate against Americans based on pre-existing conditions like diabetes or asthma or the fact of being a woman. All those things they want to go back to. And I would just remind everybody that between the years 2000 and 2008, insurance premiums doubled while the profits for the top insurance companies quadrupled. And so we are now beginning to get those costs under control and provide greater benefits to more Americans. It's ironic, Brad, you mentioned the fact that Mr. Jim DeMint is going around the country trying to defeat Obamacare, we all know that the Heritage Foundation, way back when, was actually one of the authors of the idea that every American should take some responsibility for their health care, and that those who couldn't afford it would get a little help in the form of a tax credit. That was their idea for individual responsibility. That's why it became the heart of Romney Care in Massachusetts. And that's why they can't come up with an alternative, because Obamacare is based on the idea that they put forward. Now, as others have mentioned, obviously, we're willing to make adjustments as we put this piece of legislation in place. But the core of this is what's going to provide affordable care to millions of Americans. And our Republican colleagues are not interested in making adjustments to improve it. They've been clear about that. They just want to defeat it and turn the insurance business back over to the insurance companies. And the reason they're so desperate to try to try and defeat it now in October is not because they don't think it will work, it's because they think it will work. And once it works, all the scaremongering, all the misinformation they put forward will be exposed for just that, the misinformation that it was. Look, the same was true of Medicare. They're afraid that a few years from now, people will see Obamacare like they see Medicare. That's what they're most afraid of. And it will undermine and undercut their whole theory that the government cannot play any useful role in making sure that Americans have affordable care. So they started with repeal and replace. Years later, there's no replace, other than returning to the days when insurance companies could discriminate against Americans and make large profits doing it. We have a better answer. Let's move forward. Proud to do it. And with that, I'm really pleased to introduce my colleague, Jan Schakowsky, who's been such a leader in this for so long.
Thank you, Americans United for Change, and my colleagues we stand really on the verge of a great day, October 1st, when millions of Americans will begin to have the opportunity to learn about the kind of affordable care that they're going to be able to get. You know, I'm about to return to a committee meeting of the Energy and Commerce Committee, on which I sit, and I'm on the Health Subcommittee and help to draft language for Obamacare, which I do believe will be up there with Social Security, Medicare, and Obamacare as the great advancements in this country for the American people. And even as we speak right now, there are people attacking in that committee hearing Obamacare, and we are likely in the House of Representatives to have the 41st vote this week to repeal at least a part of Obamacare.
On the continuing resolution.
Yeah, on the continuing resolution. I am really mystified as to what the Republicans can say that would really justify repealing Obamacare. And we saw that this summer, and I thank Americans United for Change and all of the advocacy groups because it's so different than it was in 2010. As this legislation rolls out and people experience its benefits, not just hear the myths and the lies about it, they are standing up at hearings and saying to Republican members, but wait a minute, I am a victim of cancer. I want to be able to get the insurance that I need, to get the care that I so desperately need. Do you want to take that away? All the benefits that have been mentioned, they would snatch from people just at the moment that they're about to extend to the 129 million Americans who have pre-existing conditions. Frankly, I think that's an understated number because it's pretty hard to get to of a certain age, or even young people, or even children that are born with pre-existing conditions, to not give the insurance companies an excuse to exclude them. Those days are about to be gone. I can just picture the anxiety, the worry, the heavy load that Americans carry on their shoulders, worrying not just about the care for their diabetes or for their cancer, lifting off their shoulders. This is not Republican. This is not Democratic. This is Americans that are worrying about their health care. And so we've seen all the numbers already. 17 million children with pre-existing health conditions don't have to worry about being denied coverage. In America, being a woman has been a pre-existing condition. Over our lifetimes, we have paid about 48% more for health care, and no longer will that be true, and we can't deny maternity care. We can't consider a C-section or even pregnancy a pre-existing condition and a reason to charge more. We have seen, just in the last month, 8.5 million Americans have seen rebates because now 80 cents out of every dollar has to be spent on health care. And if it isn't, checks have to go out, and 8.5 million Americans received them just last month. I want to say one other number, and that number is 25. I know that Ted Cruz from Texas is one of those leading obstructionists in the fight, so I want to focus on the number 25. We can implement Obamacare. We are implementing Obamacare and cover at least 25 million more Americans, or we can put the insurance companies back in charge and look more like Texas, where 25% of the population is uninsured. I think the choice is really simple. Thank you.
Thanks, everyone. We can take questions now. I do want to say that there is a hashtag for today's event, Don't Repeal. But I think I like yours better. Get over it is what the hashtag that we should use as it relates to the Republicans. So I think any of these members would be glad to take any questions if you have any. Sounds like our work here is done. All right. Well, great. Well, thanks everybody, and let us know if we can help. Thank you. Perfect. Y'all are so on message. Y'all really took the gear and all the other stuff. Quite a lot, but now we're going to have a different resolution.
Do you think that's going to put a lot more pressure to pass some kind of bill funding the government without the shenanigans?